The slower than expected rollout of the vaccine is a complicated issue that will require more than one solution. And a former FDA commissioner tells us there's more than one reason for the lag. The commissioner turned Duke Health Policy Center director says hospitals just don't have enough people who can administer vaccines. He says the state needs to consider partnerships with local doctors' offices and pharmacies to help vaccinate. And at the federal level, he wants the CDC to do more to encourage the public to trust the vaccine.
More public education and outreach around helping people get their doubts or concerns about the vaccines addressed, and especially focused on some of the lower income and minority communities where I think we're already starting to see some disparities emerge.
CBS 17 digital reporter Judith Rotana is laying out more of the problems and potential solutions, along with how realistic the Biden administration's goal of 1 million vaccinations a day is. You can find that online at cbs17.com.
In the first week of 2021, the current COVID trends surpassed what we saw in 2020. CBS 17's Colleen Quigley digging deeper and comparing the data from this current surge to spikes we saw last year. Colleen?
Yeah, so Angela, I'm outside of Duke Raleigh Hospital. I'm told here and across the Duke Health System, they're seeing more COVID-19 patients than they ever did, even back in July when we thought we were in the peak of the pandemic. An ER doctor at UNC telling me the same thing, and that they expect this surge to last several more weeks.
Tonight, 191 people are battling COVID-19 in hospitals across the Duke Health System. 43 of them are in intensive care.
This is a significant increase over what we saw certainly in the spring, and even when we previously thought we had peaked in the sort of late June, early July timeframe.
Across the UNC Health System, 480 people are hospitalized with COVID-19. 26 are in the ICU.
We're more than double where we were in July in terms of number of patients in the hospital with COVID disease.
Current hospitalizations are nearly triple statewide compared to the COVID spike this summer. At the peak in July, there were 1,279 people hospitalized with the virus. The highest number of COVID hospitalizations in 2020 was on New Year's Eve. And Tuesday, the number hit a new record at nearly 4,000.
It's putting a strain on our resources, on the nursing staff, on the providers in the hospital.
The percent positive rate is also higher than its peak in 2020, more than 16% in April, now over 17% Tuesday. Doctors say that means there's more community spread than ever before.
Even with the vaccine, we can't lose sight of the importance of, again, wearing the mask, washing our hands, frequent hand hygiene, and avoiding those public gatherings.
Well, back live now. I'm told what we're experiencing right now is the beginning of that post-Christmas spike. Keep in mind, they expect another surge because of all the people that got together to celebrate the new year. And I'm told that surge will last several weeks, expected at least through February. Reporting live outside Duke Raleigh, Colleen Quigley, CBS 17 News.